Tourette syndrome, a guide to inclusive teaching and acceptance in the classroom. According to the National Institute of Neurological Disorders, Tourette syndrome is a neurological disorder characterized by repetitive, stereotyped, involuntary movements and vocalization called tics. You may have seen a stereotypical portrayal of the disorder in recent movies. Warning, some of the language in the videos is vulgar and offensive. Then there's also a clip of a girl that actually has Tourette syndrome you can watch. The disorder is named for Doctor Georges de la Tourette, a French neurologist who first diagnosed an elderly lady in France with the condition. The onset of the condition is usually seen between the ages of 3 to 9 and affects all groups of people. According to NINS, 200,000 Americans have TS, which averages out to about 1 in every 100 people. Most people experience their worst tic syndromes in their early teens, although they can be chronic across the span of a lifetime. Symptoms and classifications. What is a tic? A tic is a habitual spasmodic contraction of the muscles, most often in the face, that is involuntary and is associated with TS. Tics are classified as simple or complex. Simple tics include eye blinking, facial grimacing, repetitive throat clearing, sniffling, grunting sounds, etc. Complex tics include words or phrases or motor movement that cause self-harm like punching oneself. Coprolalia is uttering socially inappropriate words such as swearing, and echolalia is repeating the words or phrases of others, according to NINS. Tics are usually made worse with excitement and anxiety and better with calm, focused activity. Most people with TS experience peak tic severity in their early teens and usually experience improvement as they age. Disorders associated with TS and diagnosis. Disorders associated with TS include inattention, hyperactivity, ADHD, impulsiveness, excessive worrying, repetitive behaviors, etc. According to NINS, TS is a diagnosis that doctors make after verifying that the patient has had both motor and vocal tics for at least 1 year. Because tic symptoms often do not cause impairment, the majority of people with TS require no medication to suppress tics. Some of the disorders associated with TS can be treated with medication, though, such as ADHD. Behavioral treatments such as awareness training and competing response training can also be used to reduce tics. Individuals with TS have a normal life expectancy. How to help students with TS. Recognize that tics are involuntary. The tics may sometimes seem within the student's control, but they are not. As a teacher, be accommodating and cognizant of this. Reduce stress and anxiety for the student. Identify deficits and develop strategies to support such deficits. Teachers and students should learn to ignore symptoms that can be ignored. Make accommodations for handwriting issues such as printing out notes for that student or allow them to use a computer or tablet to write. Be aware of co-occurring conditions such as OCD, ADHD, etc. associated with TS. Interventions should be creative and done causing as little distraction as possible. Develop strategies when the tic is occurring, such as allowing the student to go get a drink, go to the bathroom, etc. Communicate with parents or caregivers. Use all resources available. Classroom strategies for TS. Provide separate test locations and extend time limits. Educate others about TS and promote understanding and acceptance. Give the child a chance to leave the classroom and take small breaks. Condense and reduce assignments where feasible. Do not penalize for poor handwriting or spelling errors. Encourage the use of spell check. Provide a copy of class notes rather than having a student with TS who struggles to write notes in class. Provide items such as hand sanitizers or mechanical pencils for TS students who also have OCD. Allow freedom and movement. Acceptance. Remember, knowledge and understanding are key components to creating an accepting and supportive educational environment. When everyone around a student with TS is knowledgeable, it provides a greater opportunity for success for said student. Also, remember to use evidence-based strategies to develop compassionate and effective support. The end.